Now I'm going to talk to you about the risk factors that increase the chance of developing or having hernia. The first one is gender. Obviously, men have almost 7 times more than female chance of developing different type of hernias. And it's usually related to their fetal developments and the fact that testicles initially created inside the abdomen right below the kidney, and during the fetal development those testicle moves in the back of the abdomen and penetrate through the abdominal wall to come to the scrotal pouch, and that penetration create a weakness of the abdominal wall, and that's why the hernia, especially inguinal hernia, is almost 7 times more in men compared to female. Genetic has some association with hernia too. We've seen hernia defect runs sometimes in the family. So the father has the hernia and the son comes with bilateral hernia, and that shows you the association of the genetic with developing hernia. Now, obesity has a very strong relationship with developing hernia. Obviously, we said hernia is a defect or weakness of the abdominal wall, and just imagine if in a patient who is morbidly obese or obese, and this extra weight inside the abdomen cause constant pressure over the abdominal wall, it definitely can create a weakness or a defect in the abdominal wall eventually. And people who also do heavy activities and heavy exercise or repetitive movement that involves the core muscles, that also can put them at a little bit higher risk of developing hernia. Now, there are people that they have chronic cough, conditions with chronic cough, or people who have chronic constipation, or people who have enlarged prostates, and they have to strain a lot in order to urinate. That also increases the intra-abdominal pressure constantly, and those people, they have also higher association with hernia. Premature babies, they have higher risk of developing hernia. We've seen that in premature babies that they're born with their umbilical hernia or groin hernia. Pregnancy and labor also, as you can imagine, creates abdominal wall laxity and increased intra-abdominal pressure, which basically make the patient more prone to develop abdominal wall hernia. So we can see the belly button hernia, or we call it umbilical hernia, very common in pregnancy. We also see peri-umbilical hernia and associated diastasis recti, which we talked about. It was a separation of the rectus muscle in the center, is very common after having multiple pregnancies in female. So when we fix the hernia for these type of patients after they're done with the pregnancy, we can also fix their diastasis of recti. Now, there are people that they are on a steroid because of the other medical conditions that they have, or immunosuppressants because of the cancer, or people who take a steroid for other conditions like rheumatoid arthritis or joint problems. People who have who drink alcohol or smoke, they have a very poor wound healing. So those people, if they go under any type of surgery, the wound healing process is delayed or compromised, and therefore they have a higher chance of developing incisional hernia. Now, there are situations that we talked about. If the patient had a previous surgery, they have a higher risk of developing hernia, around 10%. And also people who have a previous hernia, they have a higher chance of developing hernia, which has something to do again with their